Okay, so let's move on. We're going to have the first contestant now in our pitch in 5. And that firm is called MEG Support Tools. And I would ask their representative please to take the stage. You understand that you have 5 minutes. And 5 minutes alone. There's 5 minutes on the clock. At 4 minutes, you will hear the bell. Bell. And at 5 minutes, you will hear the klaxon. Are you ready to begin? Please begin.
I'd like to thank Dr. Phil Hanlon for making it such an easy act to follow. So my name is Carol Thornhill and I'm from a company called MEG Support Tools, and we've built a quality management system that's used in hospitals around the UK and Ireland and Australia. So what we've done is we've worked with a lot of infection control teams, quality managers to build a digital and mobile solution that addresses things like reducing infections, creating action plans, improving prescribing, and just basically removing a lot of paper and manual processes out of healthcare and moving to a more digital, easy-to-use processes. The ECRI Institute in the US just released a research study recently that was showing the key problems in delivery of healthcare and patient safety this year were around infections in IV lines, antimicrobial stewardship, staff burnout because of the pressure that people in the hospitals are put under, and also standardising healthcare standards. So there are a lot of different healthcare standards, so the system we've built does reflect the different standards in the different healthcare systems you're in. And what that means in reality for a lot of people working in healthcare would be your hand hygiene audits, your environmental audits, your action plans, isolation procedures, there's incident reporting. So any of those paper or web-based systems you're using, we've built mobile technology to replace that. So a lot of you will probably be doing this in your current hospitals in some paper or Excel-based format. So the situation that a lot of hospitals we deal with is a mix of paper, Excel. There might be some websites you can use, but generally you can't access these at the point of care or when you're walking around a hospital. So sometimes hospitals don't collect data, and without data you can't do quality improvements, so it makes it difficult. So we built a quality management system which has audits, incident reports, action plans, access to clinical guidance at the point of care, and all of this can be used in any iPhone and Android app. It'll work on websites, it works on Windows tablets, so you don't have to buy any hardware. It's not very expensive, it's just a software license. So this means that hospitals can collect the data they need for quality improvements. And that'll be hospitals like Guy's and Tommy's in London. They replaced their web system called Wafer in 2017 with our mobile app system. And they rolled it out to all of their link nurses across all of their community and acute sites as well. And they did a research study that was published at the conference last year that showed the impact that this had on the delivery of care. So what they found was that their staff in the ID team reduced the audit time by over 50%. Instead of spending 2 days every month writing reports and action plans, this was reduced to just 30 minutes. And the fact that then you've got your action plans and patient risk information within 30 minutes means that you can close the loop. You can fix any patient risk issues in real time, which should have a huge impact on patient risk and safety. It's a very big trust, right? And it's a lot of community and acute sites. So we were able to roll this out across all those areas with very little disruption. It's very easy to use, so there was not much training involved, no hardware, not much hardware needed to be purchased. It works on any existing devices. So Anthony, their IV lead, he coined the term just MEG it. So whenever they want to go and do an IV audit, they just go out and MEG it, which makes it quite easy. So if anybody does want to see that in real life, please drop over to stand 78. We're just over here. Quite happy to show just how easy it is to do that. And if you have a smartphone, you're welcome to search for MEG Audit, download the app and try that for yourself, right? We have had independent research done on the product. There's a Canadian, also the ECRI Institute in the US did a 6-month study of 14 hygiene providers. We finished top of the pile. That was published this year. Enabling your staff to do audits, action plans helps improve morale in the hospital. So we're trying to give everybody in the hospital ownership of their own quality in their own area. So that's something we try to do. So the potential savings are quite large in big trusts. So if you were to replace paper-based audits that are conducted regularly across large employers, you could potentially save hundreds of thousands across large trusts by removing all of that time and paper from the system. We've worked really hard to make this simple and easy to use. So if you've got an iPhone and Android desktops, it works on everything. You can download the apps now for free and call to our stand, which is just in the corner over here. And Adele and Peter, my colleagues, will help you get set up. And we're quite happy to offer free trials to trusts that want to try it out. So I've got 4 seconds, so hopefully I will see you at stand 78.
Thank you.